They asked me to come today to talk about heart disease in women. So I thought we'd talk a little bit about why we're different. And I'll set the caveat that this is still an evolving science, so we don't know for sure exactly why we're different, but there are some reasons. And then some statistics, which a lot of which are covered. And then things that you can do, or risk factors that you need to be aware of so that you can work on prevention. So first thing is, how common is heart disease? Well, heart disease, particularly if you add in all vascular disease, stroke, and that is the #1 cause of death in the U.S. About 1 in 4 of us will die from heart disease or its associated condition, stroke, peripheral vascular disease. If you are a woman and you're 40, you have a 32% chance that you will have a heart attack or some sort of cardiovascular event in your lifetime. If you're lucky enough to live to be 70, then the risk drops because a lot of people that were going to have early heart disease have died. And so the other thing about us is before menopause, unless there are some unusual circumstances, some genetic predispositions, our estrogen and whatever else makes us a woman is somewhat protective. But after you hit menopause, there's a rapid acceleration and we start to catch up to the men. So, how are men different than women? Well, men are more likely to present with the things that we've heard about for years, which is chest pain, run down the arm, get all sweaty, you can go into the upper jaw, maybe cold sweats, maybe nausea, but mostly the upper 3. And so the reason men are different than women is men are more likely to have blockages of the large arteries of the heart, and I'll show you a picture in a minute. And they get these little things called plaques, which you can think of as little blockages in the arteries themselves. And when those plaques tear, the body says, ooh, there's a tear in the blood vessel, go send the clotting system down and let's stop this bleeding because we don't want to bleed to death. And indeed, then they have the heart attack. And if they have one in a certain part of the heart, they're much more likely to have what we call sudden death, which is where people just drop over dead. So in a man, if you look at the picture where you can see the larger arteries, all of these are the large arteries of the heart, that's where they're likely to get their blockages. And I don't have is there a pointer here? No. So where it says right coronary artery, left main coronary artery is the big one where the sudden death occurs, circumflex, all those big arteries. And then here's a picture of a blocked artery with an arteriosclerotic plaque. And then you get the little hemorrhage and you see that little red blood vessel there developing a blood clot, and voila, we have a heart attack. So what they do in the men, and they do it in women too, but it's easier to do in men because they have the big vessels, is they'll do a cardiac cath and they can put a stent in there if you're in the process of having a heart attack or an unstable heart situation where you're forming clots. We call it acute coronary syndrome, but that's usually what gives you the chest pain that sends them into the emergency room. And they can open that up, and because they're big arteries and they've been doing it for a long time, they're pretty good at it. But we're different. Big surprise. And so there's a female pattern disease. You can see it called cardiac syndrome X because we like to give things names. But the reality of it is we get our heart disease in the small blood vessels. So we're farther down the track, and we don't get these big plaques. So when they do a cath or a test, they may not pick it up because we've yet to get really good at detecting women's heart disease, hence your story. And so, as a matter of fact, there was a study done recently called WISE, from Women's Ischemic Syndrome Education. They found 69% of the women who had symptomatic heart disease had mild or no blockages in their big arteries. So when they go out looking at them as if they were a man, they looked okay. But in reality, it was the fact that the smaller blood vessels were affected. So ours is much farther down, and this is the best picture I could find, but if you could move it even farther down the vessel, maybe even into the heart muscle itself, because the heart blood vessels run on the outside and then go in. So that's where we get our problems. And it can be in multiple spots, so it's very hard to detect. So that's why we have different symptoms than men. And that's why invasive treatment of our heart disease doesn't work as well. And that's why we're more likely to die of a heart attack. And to make matters worse, we don't talk about it. That's why we're here today. So what are the signs of heart disease in a woman? How are we different from the men? So, and that's not the typical presentation for a woman, as you've heard today. The biggest one is sudden onset of extreme fatigue. So if all of a sudden you have an unexplained fatigue, that's a worrisome thing. And so if I'm seeing a patient like that, she's looking at me really funny when I go, you know, I think I'm a little worried about your heart. Can we do some tests and see? And you know, it may be that you're all stressed out. It may be that you didn't sleep. It may be that, yeah, but you're telling me this is new. The other thing is if you get unexplained nausea or vomiting. Now, if you got the flu and you got a fever and everybody else is vomiting around you, that's not heart disease. But if this is sort of out of the blue and nobody else, you might want to think about, maybe I need to go see my doctor, or new onset indigestion, or shortness of breath with or without activity. And then you start to get into the more men stuff, burning sensation in the neck and the jaw, or the typical chest pain. So women are also more likely to awake in their sleep with symptoms in the middle of the night, at rest, like when they're watching TV. And here's the biggie, mental stress. So if you're stressed out and you're getting chest pain, it might not be stress. It might be something else. And then you can also get symptoms with exertion like the guys do. And so the reason, like we talked about before, the reason women are more likely to do poorly and more likely to die from their first heart attack is either they don't recognize it, they don't think to push their doctor, because sometimes your doctor may not be thinking that, or when they do have it, we don't put them on the right medications, and we don't put them on enough medications. So there's issues on both sides. Medical practices moving to realize women are different. Okay, so if we have a hard time detecting it, if we have a hard time treating it, what's the best thing we can do as women? Well, the best thing you can do is to prevent it in the first place. And so you don't eat your Big Mac, but you'd be surprised that a lot of the stuff that we think are healthy, like a salad, actually isn't if it's got a whole bunch of junk on it, like cheese and all these bad fats. So, so what puts you at risk? Well, having heart disease puts you at risk for having another heart attack, or any other peripheral artery disease. If you had a little stroke, you're at risk for a heart attack. If you have diabetes, in fact, they've changed the cholesterol guidelines, and if you're over 40 and you have diabetes, you should be on a high-dose statin because it's the same as having had a heart attack. And that's true whether you're male or female. Previous heart attack or stroke, that kind of goes along with it. Kidney disease, because that's usually a vascular issue. The reason you have kidney problems is because the blood vessels are not healthy. If you smoke at any amount, drives me crazy. These young girls go, oh, I just smoke when I drink. Please don't do that. If your blood pressure is more, or is 120/80 or more, that's a risk factor. And even if you get it treated, and we don't treat it at that level, we just tell you to diet and exercise and we mean it. But if you treat it, it's still a risk factor for heart disease, so then you have to be more aware of the symptoms. If your total cholesterol is more than 200, or your LDL cholesterol is more than 50, that is a risk. Doesn't guarantee you're going to have heart disease, but it's something to think about. If your weight is, your BMI is more than 30, meaning you're obese, that puts you at risk. If your diet is bad, if you're inactive physically, or worse, when you try to exercise, you can't do it. You're having trouble getting your breath. You try climbing those stairs, you're having trouble. That's something to think about. Maybe there's something more going on, or at least this puts me at increased risk. If you have a family history of early heart disease, if your mom had heart disease before 65 or your dad before 55, you probably have a genetic predisposition to heart disease, and that's something you can't change that, but then you need to work harder on the others. The other thing we thought about is if you have a collagen vascular disease, and I'm seeing more and more women with this, with certain collagen vascular diseases, it's an inflammatory process, and inflammation increases your risk of heart disease. And so getting that treated is important The other thing is if you had preeclampsia, you know that thing where your blood pressure was high and you had all those big swollen legs and they maybe delivered you a little early because they want you to have a seizure, that puts you at increased risk of heart disease, and so prevention is more important. Or if you had diabetes or high blood pressure while you were pregnant. So here's the biggie that's just new. When I was looking up on this, I went, wow, they've really advanced this thing. Stress in a woman can actually increase your risk of heart disease. Now, it has to be bad stress, because if you love your job and you work hard at your job, or you love your kids and you work hard at your kids, and then you feel good about that, that's not bad stress. It's the bad stress. It's I have bad social relationships, I feel overloaded at work, and I hate my job. I'm unemployed, that's true for men too. I'm isolated, feel stressed all the time, or I have anxiety or depression, that puts you at increased risk for heart attacks in ways we do not yet understand. We've noticed that when they've done epidemiologic studies. So what should you do? Great, I just made you. My husband said when he read this PowerPoint, I'd be scared to death if I was a woman and I just saw your talk. So I said, well, really, I'm going to temper it. Don't worry. So if you have symptoms of heart disease, go see your doctor or come see me. Doesn't matter. Just do something. If your BMI is over 25, if you are overweight, lose weight. Don't wait till you get obese. Do something about it. A great demonstration here. Eat a healthy diet, low fat, or the latest in medicine, the latest fad in medicine for diets. And I'll give you the caveat that medicine is like women's shoes. For 5 years, we'll say one thing, and then we'll change our mind and wear another style. So, but the bottom line is, right now, Mediterranean diet seems to be a very good one. Find what works for you and eat healthy. Whether it's Mediterranean, low fat, doesn't matter. You need to exercise. You need 150 minutes of moderate exercise, brisk walking, gardening, cleaning house. My favorite, dancing. Or you can run. You can do half of that if you do something really vigorous, such as run. You want to do some resistance training because you want to keep your muscle mass up, because as we age, we lose muscle. If you can keep your muscle mass up, then you will have more muscle and you will have less of these bad hormones that come from replacing muscle with fat, and that's better for your heart. Obviously, if you smoke, don't. And then reduce your stress level. There's a lot about mindfulness now. I saw something in the Time magazine yesterday about mindfulness, and basically it's unplugging from your phone, your TV, and your iPad, and your laptop, and doing something that is enjoyable to you or relaxing or something along those lines to reduce your stress for at least a period of time. And I know everyone's going, she's completely out of her mind, but you really will feel better if you find some time just to kind of unplug. If you have depression or anxiety, there are medicines for that. I will be completely honest, we do not know if those medicines prevent heart disease yet because we haven't done the studies, but you'll feel better. And then get your cholesterol checked, and if your doctor says you need a statin, even though it doesn't make a whole lot of sense, try it. Because the newest guidelines are going to have a lot more people on statins, because what we've learned is your number isn't as important as if you're at risk, the statin prevents you from developing heart attacks. And that's really all our studies for 10, 15 years have really shown. And so, you know, it's one of those, everyone's like, oh, I don't want to take medicine because that gives me a disease. Yeah, well, we're trying to keep you from getting a disease. So that's it. And I'm open for any questions. Yes?
You know, there's been a lot coming out about statins. I've been on scared about them. What about taking them?
So statins, there are a few people, and they're rare, that don't do well on statins, and we don't have a good test yet. They're working on that. But the average person, if you start at a very low dose and slowly over time increase it, the side effects that you're worried about, the liver, that's actually not as common as we think it is. And the muscle aches seem to be the ones that are the most debilitating and what everybody worries about. If you start very low and move up very slowly, then oftentimes we can get you on a statin. We may not be able to get you to the recommended dose, but we can get you on something, and something is better than nothing if you're at risk for heart disease. Yes, ma'am.
What are some of the pharmaceutical names for the statins? I'm on a lot of medication, and I may not know that it's a statin, and I'm sure some other people.
So Lipitor or atorvastatin is the generic one that's one of the high-dose statins that is recommended for people that need a high-dose statin. Cressidor is the other one. There's another one that I never prescribe and can't remember the name of it.
What about Vytorin? Is that a,
Vytorin is a mixture of simvastatin, which is a lower dose statin, and Zetia, which is a one of the drugs that's not been shown to make a difference in heart disease. So I'm switching my folks from some of those drugs, and I do it very slowly because I never believe in doing anything fast for side effects, switching them very slowly to the new recommendations. So depending on your risk factors and all that may be just fine, but one of those drugs is falling out of favor. Again, the shoes. Get a little more information, and now we're wearing high heels. Yes?
Well, you talked about exercise, walking, but for people that cannot have the time to go to a spa, as far as the weights, how much weight do you recommend? Or
So if you're doing just upper body as a woman, you probably want to start with 1 or 2 pounds. And an upper body for a woman, probably no more than 5 to 7.5, 10 pounds at the most if you're doing, curls or something like that. So because our upper body, we're much stronger below the waist than above the waist. You guys build these big old muscles. You don't need to lift heavy stuff. You'll hurt yourself. So start low and slow and build it up. And the idea is you're heading towards a direction, and then sometimes getting a little help on how much I should lift. Even is, you don't want to pull a disc in your neck or tear a rotator cuff, shoulder muscle, something like that, just because you're not being wise. Yes?
I have a question. So if you were one that maybe 40 years ago when you were younger, you might have been a smoker in college with friends like you just described, and for maybe 30 years since then you cleaned up your act and you're marathoner and you're an exercise freak and you're really eating a healthy diet, is there a point where you're able to reverse some of that damage you might have done from growing up in a family that ate high fat and all that? Talk a little bit about that.
Yeah, so if you just smoked in college and you saw the light of day and you quit, you've been 10 years out, you go back to whatever you would have been.
Okay.
Yeah.
What about the eating, growing up eating a high fat diet in your
Same thing. You can, so the message is, there's never too late to make a change. And the longer you have the healthier diet and the exercise and all that, the better the effect. Yes.
what do you do for patients who have particle sizes that are either way too big or too small? How do you treat those?
So that is a great question, and that's my comment about the new cholesterol guidelines, and the medical community is still arguing about that, and we will for 10 years. But the data shows, the studies that they've shown, don't go down to the particle sizes. So the problem is, when they looked at the studies, they said, okay, these group of people are going to take a statin at this dose, and then we're going to look to see if they die of a heart attack. Well, if they're on the statin at either high dose or low dose, they are on high dose, they're less likely to die. They're a little less likely to die if they're on medium dose compared to no dose. No one looked at all these particle sizes and all that we have gone down that path. Now, we can use the cholesterol drugs to change the particle sizes, and that's been great for the pharmaceutical companies. But the reality of it is, we don't know that makes a difference as far as your risk of dying. So you ought to stick with what we know, because in medicine, we like our blue shoes, we like our red shoes, but we don't know whether blue or red is better. And so to try and go with what the studies actually show for evidence, the new guidelines, we're starting to go, gee, let's do what the studies say and stop trying to read between the lines. So I've moved to just going, let me put you in the calculator and see what your risks are. And do you need to be on a statin? No. Then diet and exercise. Do you need to be on a statin? You need to be high dose or low dose. it's gotten really simple. And then I'm going to check your cholesterol like they recommend. And if you're doing better, I'm going to just dance in the hall that you've dropped your cholesterol with your diet beyond what the statin did. And if you didn't, we'll have a little conversation about, I'm not dancing in the hall. So yeah, so it's changing. Medicine is changing, but we're actually going to something that makes sense based on the research. Any other questions? Yes.
A question pertaining to cholesterol. Okay, I'm in the gym regularly, and I come from a family with history of heart disease. So the total cholesterol stays a little bit elevated over 200, but the HDL is extremely higher than normal. So can you speak a little bit about looking at the total, or the importance of the total, or should you be looking at HDL and LDL only?
You look at both. So the new guidelines, the new calculator, if you're, what you do is you can actually go to the American Heart Association and look at the calculator and punch it in yourself. And they will tell you whether if your risk of a heart attack is more than 7.5%, you should be on a statin. So you can actually go and do it yourself. I don't actually have the website here, but you can do it yourself. And then, and it'll also give you your lifetime risk. And then I didn't like my lifetime risk because my cholesterol is 7 points higher. So I was like, okay, so I guess I go back and change my diet a little more. So you can actually figure it out yourself based on that.